Why is it that women's sexuality remains such a complex and often misunderstood aspect of human experience? For centuries, cultural narratives, societal expectations, and even medical interpretations have intertwined to shape and often distort women's understanding of their own desires and pleasure. This exploration seeks to untangle some of these narratives, offering a clearer, science-based perspective on female sexuality, empowering women to reclaim their agency and embrace their full sexual potential. We'll delve into the historical, societal, and medical influences that have shaped women's relationship with their bodies and their desires. This journey of understanding requires us to challenge long-held assumptions, confront uncomfortable truths, and ultimately foster a more open and inclusive dialogue about women's sexual experiences. From moral judgments to medical misconceptions and media portrayals, the forces shaping female sexuality are multifaceted and deeply ingrained. This essay aims to provide a framework for understanding these influences and their impact on women's lives. We will explore how these factors contribute to the silencing of women's voices and the suppression of their sexual agency. It is crucial to acknowledge that this is not just an academic exercise, it's a deeply personal and often political one. Women's sexuality has been a battleground for control, a site of oppression, and a source of shame for far too long. By understanding the forces at play, we can begin to dismantle the harmful narratives and create space for a more empowering and liberating understanding of female sexuality. This includes recognizing the diversity of experiences and challenging the notion of a single normal or ideal sexual response. This exploration will also delve into the fascinating anatomy of the clitoris, debunking myths, and celebrating its central role in female pleasure. We will explore the science of arousal, desire, and orgasm, providing a foundation for a more informed and positive approach to sexuality. It's time to move beyond the whispers and the shame and embrace the full spectrum of female sexual experience. For generations, women have been bombarded with conflicting messages about their sexuality. From religious doctrines that equate female desire with sin to cultural norms that celebrate male sexual prowess while condemning female assertiveness, the moral landscape surrounding female sexuality is fraught with contradictions. These moral dictates often lead to internalized shame, making it difficult for women to explore their desires without judgment or guilt. The pressure to conform to these often unrealistic and restrictive ideals can be immense, leading to feelings of inadequacy and anxiety. The concept of purity has historically been weaponized against women, used to control their bodies and limit their autonomy. This emphasis on virginity and abstinence before marriage often ignores the reality of women's sexual desires and experiences. The double standard that celebrates male sexual exploration while shaming female desire further complicates the moral maze that women must navigate. This double standard perpetuates the idea that women's sexuality is something to be controlled and regulated, rather than celebrated and embraced. Moreover, the pressure to be desirable while simultaneously remaining modest creates a precarious tightrope for women to walk. This conflicting messaging can lead to feelings of confusion and self-doubt, making it challenging for women to develop a healthy and positive relationship with their sexuality. The constant bombardment of idealized images in media further exacerbates this tension, setting unrealistic expectations and perpetuating the myth of a singular, unattainable standard of beauty and desirability. The internalization of these moral judgments can manifest in various ways, from difficulty experiencing pleasure to feelings of shame and guilt surrounding sexual thoughts and desires. This can lead to a disconnect between mind and body, making it challenging for women to fully embrace their sexuality. It's crucial to recognize and challenge these internalized messages, creating space for self-acceptance and a more positive and empowering understanding of female sexuality. Recognizing the historical and cultural context of these moral judgments is the first step towards dismantling their power and reclaiming sexual agency. The medicalization of women's sexuality has historically contributed to the silencing of women's voices and the pathologizing of their experiences. From the Victorian era's diagnosis of hysteria to the contemporary focus on female sexual dysfunction, medical interpretations have often framed female sexuality through a lens of deficiency and disorder. This has led to a focus on fixing women's perceived sexual problems rather than understanding and addressing the underlying social and cultural factors that contribute to them. Historically, medical professionals have often lacked adequate training and understanding of female sexual anatomy and physiology, leading to misdiagnosis and ineffective treatments. This lack of knowledge has perpetuated harmful myths and misconceptions, further contributing to women's feelings of shame and inadequacy. The focus on achieving orgasm as the sole measure of sexual satisfaction has also narrowed the understanding of female sexual experience, ignoring the multifaceted nature of pleasure and intimacy. Furthermore, the pharmaceutical industry's focus on developing drugs to treat female sexual dysfunction has often prioritized profit over patient well-being. These medications may address some physical symptoms, but often fail to address the underlying emotional and psychological factors that contribute to sexual difficulties. The emphasis on quick fixes and medical interventions can also discourage women from exploring other avenues of support, such as therapy or sex education. The medicalization of female sexuality can also create a power imbalance between patients and healthcare providers, further silencing women's voices and reinforcing the notion that their experiences are somehow abnormal or deficient. It's crucial for medical professionals to adopt a more holistic and patient-centered approach to female sexual health, prioritizing open communication, informed consent, and a deep understanding of the complex interplay of biological, psychological, and social factors that influence women's sexual experiences. Section 4. Media's Mirror. Reflecting and reinforcing cultural narratives. The media plays a powerful role in shaping our understanding of sexuality, often reflecting and reinforcing existing cultural narratives. From movies and television shows to magazines and advertisements, women are constantly bombarded with images and messages about how they should look, feel, and behave sexually. These representations often perpetuate unrealistic expectations, contributing to feelings of inadequacy and anxiety. The media's portrayal of female sexuality is often filtered through a male gaze, prioritizing male pleasure and objectifying women's bodies. The overemphasis on youth, thinness, and a narrow definition of beauty can lead to body image issues and a disconnect from one's own desires. The pressure to conform to these idealized images can be immense, making it challenging for women to embrace their own unique beauty and sexuality. The media's portrayal of sex is often sensationalized and unrealistic, further contributing to misconceptions and anxieties surrounding intimacy. Furthermore, the lack of diverse representation in media can reinforce harmful stereotypes and marginalize certain groups. The underrepresentation of women of color, LGBTQ+ individuals, and women with disabilities perpetuates the notion that their experiences and desires are somehow less valid or important. This lack of inclusivity can lead to feelings of isolation and shame, making it difficult for these individuals to develop a positive sense of self and embrace their sexuality. It's crucial to be critical consumers of media, recognizing the ways in which it can shape our perceptions and influence our self-esteem. Seeking out diverse and inclusive representations of sexuality can help to broaden our understanding and challenge harmful stereotypes. Supporting media creators who prioritize authenticity and empower women can also contribute to a more positive and inclusive cultural landscape surrounding female sexuality. Section 5. Embracing diversity. Recognizing the spectrum of sexual response. Human sexuality is incredibly diverse, and women's sexual experiences are no exception. There is no single normal way to experience desire, arousal, or orgasm. Embracing this diversity is essential for fostering a positive and inclusive understanding of female sexuality. Recognizing the spectrum of sexual response allows women to celebrate their own unique experiences without judgment or comparison. It's important to remember that everyone's journey with sexuality is different, and there is no right or wrong way to feel or express desire. Some women experience high levels of sexual desire, while others may have lower levels or experience fluctuations in their libido throughout their lives. This is perfectly normal and does not indicate a problem or dysfunction. Factors such as stress, hormonal changes, relationship dynamics, and even medication can all influence sexual desire. Understanding these factors can help women to better understand their own bodies and experiences. Similarly, the experience of arousal and orgasm can vary greatly from person to person. Some women may achieve orgasm easily, while others may require more stimulation or may not experience orgasm at all. It's important to remember that orgasm is not the only measure of sexual satisfaction, and that pleasure can be derived from a wide range of sexual activities and experiences. Focusing on intimacy, connection, and communication can enhance sexual satisfaction regardless of whether orgasm is achieved. Embracing diversity also means backgrounds. Recognizing the intersectionality of these identities is crucial for creating a truly inclusive and empowering understanding of female sexuality. It's important to create space for open dialogue and respectful communication about the diverse range of sexual experiences and preferences.